Welcome to In Session, where we discuss the pivotal challenges facing Ohio with leaders who are stepping up to meet them. I'm Michelle Grimm. Today, we're talking about reproductive health care and specifically about access to in vitro fertilization, or IVF. IVF has been a lifeline for countless families, helping them achieve their dreams of parenthood. In 2021 alone, over 2,200 births in Ohio resulted from IVF treatments. But recent legal debates and court rulings have created uncertainty around protections for those seeking IVF. To address these concerns, Representatives Brown Piccolantonio and Anita Samani have introduced House Bill 502. This bill aims to safeguard access to IVF in Ohio, providing clarity and protection for medical professionals and patients alike. House Bill 502 is about supporting families and respecting the diverse beliefs of Ohioans, ensuring that personal reproductive decisions remain just that, personal. Today, I'm joined by Representative Brown Piccolantonio. Representative Brown Piccolantonio, thank you for joining us today. Tell us a little more about House Bill 502.
Sure, thanks for having me. So as you said, this is a piece of legislation that I worked on with my colleague, Representative Dr. Anita Samani. What the bill would do is, number one, it would protect anyone's right to assisted reproductive technology like IVF. It would provide much needed clarity to our medical providers who are providing those services. Specifically, it would provide both civil and criminal immunity for providers, for facilities, for healthcare personnel who provide assisted reproductive care, and also provide that protection for the patients who are seeking that care. It would also provide some protection of information so that anyone who was seeking that type of treatment would know that their medical information would remain private. So, citizens of Ohio passed Issue 1 last November, which would essentially protect reproductive rights in the state of Ohio. So how does this bill kind of complement that constitutional amendment? Sure. So this bill reflects what a majority of those in Ohio said when they voted to pass, quite frankly, both the August and the November Issue 1. It would put into state law just that very specific protection related to freedom to exercise, the ability to make one's own choices related to starting or growing a family. So why is this bill important and how does it put people first? There was an April 2024 Pew Research study related to the way that not just Ohioans, but the way that all Americans feel about IVF. And 70% of Americans actually think that IVF is a good thing. So this legislation would reflect what not just a majority of Ohioans believe, but what a majority of all of us who live in this country believe. I'm a mom myself. Each of us who choose to have children experience our own unique journey toward that. And it's not always a very straight line. I know my own path towards motherhood was complicated. I did not go through IVF procedures, but those journeys are all pretty individual. Mm-hmm. And I think that making sure that our law reflects the ability of each one of us to make the choices that we need to make in order to either start or grow our families, that is putting people first mm-hmm. in our laws when they reflect that ability to exercise that kind of freedom.
So can you tell me more about the benefits of IVF?
Sure. IVF right now, let's see, according to the American Society of Reproductive Medicine, 10 to 15% of couples experience infertility. And according to the CDC in 2021, IVF led to 2.3% of all births in the United States. And what that translates into in Ohio, there were actually 2,226 children born using IVF procedures. So even though maybe those percentages sound small, that is a whole lot of individual babies, children, people. And that is a pretty big impact that a procedure like IVF can have.
So what is the reason why you chose to joint sponsor this legislation with Representative Samani?
So after issue 1 passed in Ohio, I think a lot of us were kind of shocked when a court in Alabama issued a decision finding that reproductive material had the same legal status as a child. And even though in Alabama, it seems that even the lawmakers there were stunned and acted quickly in order to pass law to make sure that protection for access to IVF remained. I think just having had that court decision happen shook a lot of us. I know that I was hearing from my own friends who had chosen to use IVF or had friends or family who used IVF to start or grow their families. I also heard from a couple medical providers who were feeling just uneasy about what the status was going to be in Ohio. And so I thought, and I think Dr. Samani and we both believed that it was important to pass legislation to make sure that it was clear, both to people who might seek IVF procedures and to the providers who perform those services.
So why do you believe this will help protect reproductive rights here in Ohio?
Well, it will. What this law will do is just respect and uphold what the voters decided when they passed issue 1 last year. We resoundingly support the constitutional right to make and carry out our own reproductive decisions, including infertility treatment. I think that it also was shocking to see at the federal level that our Congress could not get themselves together in order to put those protections in place. But passing this law in Ohio will at least give Ohioans that certainty that our laws reflect what is now in our Constitution.
So you touched on Congress not being able to pass anything around IVF, and it would help here in Ohio. So as far as I know, there hasn't been any Republican support here in Ohio for this bill. Why do you think that might be?
I wish I had an answer to that question. I have been a little bit disappointed and frustrated. We haven't even had one bill hearing yet, nor have we heard from any of our Republican colleagues who want to join with us in making sure that this bill moves so that people have the security and the protection of knowing that they can continue to access IVF procedures. And I don't know the answer to that question. I know that our Republican colleagues say that they believe in protecting life and family, but this is a bill that actually does protect life and family and freedom, and I would think that it would be something that they would want to help see move. But like I said, we have not yet had a bill hearing, nor have, to my knowledge, I don't think Representative Dr. Samani has heard from anyone. I know I haven't either.
So can you talk to me more about the recent U.S. Supreme Court decisions that we've had recently around reproductive rights?
Sure. This term, the United States Supreme Court actually heard 2 cases related to reproductive freedom. One of those cases is related to what is commonly called mifepristone, which is a medication used to assist with abortion. The second case that the Supreme Court heard this year was related to the Federal Emergency Medical Treatment and Labor Act, which is commonly known as EMTALA. EMTALA is a law that requires hospitals who accept Medicare to provide stabilizing treatment to any patient who's experiencing a medical emergency. This was a case that was out of Idaho, which had just passed a law that would ban all abortions. And the question was whether or not the hospitals would be required to continue to provide that care to a patient who had undergone an abortion procedure. The reason that I'm bringing up both of these cases is that even though the decisions that were issued by the Supreme Court, ultimately, they did not change anything with respect to our rights to have access to medication abortion, or our rights under EMTALA. Both of those cases were dismissed on procedural grounds, and so the court didn't actually address the underlying substantive issues. So the questions remain, and I think the uncertainty remains about what will our ability to access treatment, our ability to exercise what is a fundamental freedom to control our own bodies, to make our own medical decisions. What does that look like in the long term?
Great. So going back to House Bill 502, so what comes next, and how can people support this legislation?
That is a wonderful question. I hope that what comes next are some hearings. Obviously, I would love to have a first hearing and give sponsor testimony, but what I would really like to have happen is to have an opportunity for a second hearing where both individuals who have undergone IVF procedures and also some of our medical professionals who provide these services will have the opportunity to come and testify and tell their stories, talk about the difficult decisions that they had to make, talk about what the process was like for them, talk about, from a family perspective, what it's meant to families to be able to access these medical procedures that have allowed people to have a family. I also, like I said, I think it's important to hear from medical providers about the kind of anxiety that they are under right now, not knowing exactly what they are and are not permitted to do, or what they will be or will not be permitted to do in the future. So what I would really like to have happen is have some hearings. I think that if people are wondering how they can help make sure that we have hearings, I would urge them to please reach out to their own state representatives. I would ask that people go onto the website and look at the Public Health Policy Committee, reach out to any members of that committee, but specifically reach out to the chair, Chair Matthews, and ask that this bill have a couple hearings.
Great. And one last question for you. What else are you working on this General Assembly?
So in addition to this bill, I have, I think, 7 other bills that I have introduced this General Assembly. Some of them have had hearings, some of them have had no hearings. So I'm preparing and hoping that those hearings will happen as soon as the legislature comes back from recess. I am also working my way through a list of ideas that I have that constituents have talked to me about, issues that are important to them, and working with our wonderful staff at the Legislative Service Commission to do some research and write legislation.
Representative Brown Piccolantonio, thank you so much for joining me today. That wraps up today's discussion. From our chamber to yours, thank you for tuning in. Until next time, stay informed, stay engaged, and remember that democracy is always in session.